Good morning. Thank you for joining us today at our Noble Medical Service podcast. Today we're joined by our pulmonologist, Dr. Manuel Suarez. Doctor, today we'll be asking you some questions that are normally asked by our patients in regard to the pulmonology topic. Can you tell us a little bit about your background?
Yes, I'm triple board certified, but basically as a board certified pulmonologist, I would be very more than happy to talk about the different questions that the patients would have.
We're going to address the most common questions patients usually have about lung health, prevention of respiratory diseases, and the importance of vaccines.
Okay, as a board certified pulmonologist, internist, and also critical care, we take care of a lot of people with lung problems. And the lungs are extremely important. In fact, the lungs and the heart really can't be really separated. They work together. One helps the other. So we need to look at that. And a lot of it is just prevention. The old saying, an ounce of prevention is worth a pound of cure. That is very true, no matter what language you use it on. And the main things that especially the elderly patient want to do is, number one is make sure that they have their vaccines up to date. Okay. Listen to their body. Their body says, I'm tired. Don't overdo it. Take a break. Especially now with the heat, be very, very careful with overheating, shortness of breath. It's very easy to get dehydrated. So the simplest things are actually the most important things. A vitamin, fish oil, certain things are very natural for them to do and usually are agreed upon by their private physician.
Right. Doctor, why do you think it's so important to take care of lung health from an early age?
Well, that's an excellent question. The earlier you expose the patient to problems, the harder, the more harm it does. For instance, kids, if they're working or playing in a dusty area or smoke, etc., they tend to be much more asthmatic and allergic than those that are not. In a lot of places, we forget that what they use for fuel to cook is actually the feces of the animals that they have in the farm. So that itself has no ventilation. They inhale that and they call it dung lung, which is not uncommon. We're very centric as a U.S. We have to realize that most people are below our standard of care, and they do a lot of things that are harmful, especially the younger they are.
Right. What daily habits harm our lungs the most, even without us noticing?
By far, smoking, okay, or any type of nearing any type of smoke or anything like that. If you were in Los Angeles or in a major metropolitan area, I would tell you that pollution is extremely important. The pollen count if you're allergic. So which way is the wind going? Which is the pollen count. You're allergic, do you get eczema, do you get rhinitis? Those people that have that tend to get asthma. And asthma is really a significant problem in the elderly population as well as the young population.
Okay. Is it true that only smokers develop serious lung problems?
No. In fact, a lot of the serious lung problems have nothing to do with smoking. It could just be asthma. It could be an allergy to eosinophils. It could be what's called Monday morning asthma, where somebody just wakes up and they work at a place where something is really causing shortness of breath, but they don't know, so they get worse during the week, and then they get better during the weekend, and then Monday they get back. So there we like to either know what is it that they're using. We use allergen tests. We use bronchial provocation tests to whatever it is that they're using at the time, or just to see if they're asthmatic to begin with.
Right. Does air pollution and exposure to chemicals affect the lungs as much as smoking?
Not as much as smoking, but you also got to realize that there's no filter. Right. So on a day where, for instance, in Los Angeles, there's days where they'll give you, yellow, green, red, and on the red days, and especially, for instance, in China, you'll see people the Chinese people are very, very strict to what they do. So they actually will wear masks depending on the day. So on a red day, everybody's wearing the mask. Here you see bandanas, etc. We're not as as effective as following the guidelines that the doctors give, were not as effective as other countries.
What preventive checkups do you recommend for someone who has never had respiratory symptoms?
They should definitely just see their regular physician, especially from a young age, the pediatrician. Mm-hmm. Okay, then after that, if it's a woman, of course, their period and their other functions. But what's the most important is also what are they drinking? What kind of milk are they having? There's a lot of milk allergy. In fact, if somebody, I'll give you an example. If you're at somewhere where they sell pastries, and all of a sudden the child next to you starts having shortness of breath, and they can't, and they wheeze, and they start. What's happening is they're actually allergic to peanuts, and what they're doing in the back is they have peanut oil, and the peanut oil is being aerosolized, so the child gets hit with it, and then they have a major attack. Now we've always had the injections for the synephrine for allergic reactions, and now there's a new one called it's a nasal spray. Mm-hmm. It's much easier to use, and you just put in the nasal spray, push, and you're ready to go. It will tend to repeat, so not just one shot, they get better, and everything's over. They have to be watched closely because the allergy can repeat itself just with one exposure.
Oh, sorry. Why is the flu vaccine recommended every year?
Because it changes, and then with that change, we make the change in the influenza vaccine. Also, what happens even without flu, and one thing that's important is most people say I got the flu on a Thursday, and then they're back on Monday at work and they're feeling fine. That was not the flu. Okay, that was a regular cold. We get it every year. Right now, we're getting all the snow birds coming down. The snowbirds are always going to bring a benign cold that almost everybody gets it, like a mild pandemic. Okay, but most people get over it. Doesn't really cause a problem. You just have to be careful with it. Now, influenza feels like every bone in your body is broken. You have 103 temperature. You feel like, no pundit, you feel terrible. And I could use another word. But the point here is rest, fluids. Now, if you come to me within 48 hours of having the flu, I can start you on oseltamivir, which is an anti-flu medication, and which will help you. But it has to be within the first 48 hours. After 48 hours, it's not effective. For instance, if we switch over to COVID gives you up to 10 days to be able to use the Paxlovid. I take it back 5 days. It incubates for about 10 to 14 days. Mm-hmm. But instead of 2 days, you can take up to 5 days of symptoms to be able to complain and then be able to get the medication.
Can influenza really become that dangerous for the lungs?
It is not only dangerous, it's very deadly. In fact, influenza vaccines are very important because if you get influenza, it's not unusual, number one, for the influenza to advance and give you major problems, not only if you already have COPD or asthma, but there is a very common pathway that's known that once you have influenza, you can get easily what's called infection by either pneumococcus or methicillin-resistant staph, and that in itself is deadly.
What would you say to those that got recently vaccinated and say that they still caught the flu?
Just because you get vaccinated doesn't mean you get the flu. You don't get the flu. What I will tell you is, if you get the flu and you've been vaccinated, you're going to get a much milder form of flu than if you weren't vaccinated. So it helps either way. It either prevents it completely, or it makes it better. You don't have to go through. I'm telling you, if you go through flu once, you will remember what I just told you about. In fact, another name for it is called break bone fever, because every bone in your body feels like it's broken. That's how much pain and fever and discomfort there is.
Which kind of patients benefits the most from this vaccine?
The sicker patients. So the sicker you are, the better you do or need the vaccine, because the sicker you are, the least you need more complications in your problems. But so, for instance, people with cancer, they're immunosuppressed, immunocompromised, people with COPD, people with respiratory problems. But if you go down the line, almost everybody fits a vaccine. In fact, pregnant women, people who are, we're giving a vaccine to people that are completely healthy. So once again, it's prevention, and it's a one shot. And pretty right now they're working on what's called like a super vaccine, which is going to be one vaccine that's going to cover every other vaccine. For instance, RSV is important for the elderly, not so much because they get sick, but it's because the children get sick. So, and for the children, RSV is very, very bad. So what happens? You're a grandfather. You don't get the RSV vaccine. You get RSV. You pass it on to your grandchild. And next thing you know, it's a vicious cycle.
When should a common cold worry us enough to see a pulmonologist?
Anytime there's a fever and it doesn't break, okay, where the patient is not sleeping well at night, they're having they could be having soaking sweats, cold chills, the appetite is gone, any major changes. Once again, it's better to go see your physician early and have it be nothing than to wait too long and then all of a sudden, like I said, you don't come within 48 hours, there's no treatment. Now I got to treat you symptomatically. The symptomatic treatment may not work, and then most of the time, if it does work, the pills that we're using are going to affect your stomach because it's just what happens, and you wind up not eating because you're swallowing phlegm. Mm-hmm. So that's why you're not hungry at all because you're constantly digesting phlegm, so you don't feel like eating. It's a vicious circle.
What warning signs show that our lungs might be at risk?
Shortness of breath is very important. Okay. Coughing up phlegm, especially that's discolored phlegm. The amount of phlegm is also important. But shortness of breath by far is the most important. And nowadays, everybody should have like a $20 oximeter at home. A lot of people came to life, and during COVID, you put it on as long as you have 90% or better oxygen saturation. That's a good sign. If you fall below that, you really want to go to the hospital or go to the emergency room.
Does exercise really strengthen the lungs or only the heart?
They don't strengthen the lungs, and they really don't even strengthen the heart. What they do is they give you more stamina. So in other words, imagine I put you running at with a bag of 20 pounds of groceries. Mm-hmm. You are going to feel much more short of breath if I take those 20 pounds away. Sure. So that's the part that's really important. And then you'll see people early on, they'll drive for 5-10 minutes to try to find a parking space that's near where they're going. So they don't realize it, but they're already compromised, and the body's talking to them and saying, "Listen, you need to change." The fortunate or unfortunate part of our body is that by the time we get symptoms, we have to lose more than 90% of our function, which is good in a way because we have a lot of space to play with. But then at the same time, by the time you start getting symptoms, you've lost a lot of that extra amount. So it's a double-edged sword.
Right.
Yep.
What type of physical activity do you recommend to improve lung capacity?
Just simple walking. And for instance, everybody, you don't have to go especially with our heat. Just go to the nearest store or a place where you can walk around. It's air conditioned. You don't have to pay for it. Every 10 or 100 feet, there's a chair or where you can sit down. Or there's people that are walking with their walkers and have their chair. So they're in an air-conditioned place. They're being entertained. They're seeing other people. They're able to get their exercise in. And the most important is not to become bedbound, to become active. In other words, your activity of daily living is what's called the ADLs. Without that, you cannot be admitted to a nursing home or to an ALF or anything like that. or you're putting extra pressure on your family. So there's a lot of things that come into play that people don't think about.
Are there foods or supplements that help maintain better lung health?
Yeah, I mean the biggest one would be vitamin C. It's not so much lung health. Is that vitamin C is a very good antioxidant, and it also gives you prevention from certain viral diseases, and that's what usually prevents lung development. And also, of course, being born with normal lungs, and also no predisposing lung or heart problems.
Doctor, if you could give just one piece of advice to everyone listening today to protect their lungs, what would it be?
I would say listen to their body, keep away from any areas where there's high. If you can see the smoke, okay, that's going into your lungs. Okay, cigarettes, vaping is the big problem nowadays. So if you keep, in fact, when you first come in, there's a thing called EVALI, which is called vaping acute lung injury, and that can actually lead to ARDS. It can look exactly like COVID. It can look exactly like influenza. It's usually seen in young people who are vaping certain chemicals, which they don't even know what they're buying. They're buying it off Amazon. They're buying it off different areas. And that's why the government is coming down on it so strongly. And also the flavors bring in the kids. You know, there's many little things that are being done that are kind of hurting the community without knowing. But smoking, keeping away from big time allergen days, with those big allergy loads, and anything that you can see that smoke, stay away from it. And also stay away from other people who are sick. In other words, why can't we control viruses? Very simple. You may fall with a virus today and you feel just fine. Okay? 3-4 days from now, when you've had the incubation period, that's when you start feeling bad. And then you say, you know what, I'm not going to go to work because I'm a nice person and I don't want to really make everybody else sick. It's too late. You were most infectious when 2 days into but you weren't symptomatic. So by the time you're symptomatic, you've already pretty much coughed and infected the whole office. That's why typically one person in the office gets a cold and it's a bad one. It typically goes around. You just have to and it comes around at different times because they have different periods of incubation. It may take 3-4 days. It may take 5 days. It may be worse on some people, and it may not be worse on others. But it tends to go around, and that's why we can't control it. Number one, we don't have a drug for it, and number two, you're asymptomatic. You have no symptoms when you're most invasive.
Thank you, doctor, for joining us today. I hope that this answers all the questions that our patients had. If there's any other questions that you guys have for our pulmonologist, leave them in the comment section below, and next time the doctor's here, we'll be answering them.
And we look forward to seeing you, and hopefully you'll stay healthy in the meantime. Best place to get evaluated would be to just call Nova, and we talked about our services, and we would probably be more likely, we'll be more than happy to help you be able to see a pulmonologist.